your presentation, you explored the central nervous system manifestation of ATTR amyloidosis. What are the main neurological symptoms that clinicians should be aware of?
Okay, so the main symptom of CNS dysfunction in this population are transient focal neurological episodes, TFNEs, and these are short episodes of self-limiting cortical dysfunction. They usually last a few minutes and resolve on its own, but they can recur, and they usually recur in the same patient. Another important potential complication is hemorrhagic stroke, particularly lobar hemorrhages and subarachnoid hemorrhage. And finally, cognitive dysfunction also seems to be very common, particularly executive function, dysfunction, memory and learning problems.
And what strategies or diagnostic tools are currently available to detect and monitor CNS involvement in ATTR amyloidosis?
There are a few studies with PET scans. So both PET and foot-metamol PET have been shown to mark TTR amyloid in these patients. So that might become a useful biomarker to monitor disease progression in the central nervous system. We also have a little bit of data on MRI, but still with contradicting findings. So we do need more data.
How can a holistic approach, including attention to this manifestation, improve the overall management and quality of life of these patients?
Well, first, I think it's important to look for the symptoms, particularly TFNEs, because they can be very scary, especially if it's the first time a patient feels them. And for them to understand what is happening, I think could help integrating this information. Also, anti-epileptics have been used in the treatment of these TFNEs. We don't have a very good evidence, clinical evidence that it is effective, but on the theoretical point of view, they probably reduce the risk or the frequency of TFNEs. So inquiring about them and treating them when they are very frequent is an important step to have, particularly in patients with long-standing disease.